PBS Utah presents the Governor's Monthly News Conference, an exchange between Utah reporters and Governor Spencer Cox.
Ladies and gentlemen, welcome. It's great to be with you again. It's hard to believe another month has flown by. It has been, I guess, 101 days since our administration was sworn in, and it's been an incredible honor over the past 100 days to serve as your governor. It has not been perfect, but we have an incredible team, and we're very proud of what we've been able to accomplish over the past 100 days. Now, as always, we want to talk about the coronavirus and our COVID response and vaccinations. But before I do that, I do want to give a little reminder on a different topic. It was just 13 months ago that we were reminded that Utah is also earthquake country, and preparedness works, and this year is no different. So please don't let the experience of the past year go to waste. Our state needs you to continue preparing. Just take it one step at a time. We want to encourage people to start, if you haven't, storing some food and some water. Keep it in your pantry or under your bed if you don't have a lot of space. Remember this is the important thing, to drop, cover, and hold on if and when that shaking starts. So the Great Utah Shakeout is a day that we set aside to encourage you to do your earthquake preparedness wherever you are. You can register at shakeout.org/Utah. That's shakeout.org/Utah, and join over 700,000 people in this drill every year. Just a good and helpful reminder. Now, we want to talk a little bit more about vaccines and vaccine eligibility. This is a little bit of a change. We are no longer discouraging individuals who have tested positive for COVID-19 within the last 90 days to wait to get their COVID-19 vaccines. We do have enough supply as supply continues to grow and as more and more people are getting vaccinated now to allow for this change. So the verbiage which outlined this recommendation will be removed from the governor's vaccine distribution plan executive order starting today, April 15th. Individuals should wait to get vaccinated until they don't have any symptoms from their COVID infection, and once they've been released from their quarantine or isolation period. If a person has had long-term symptoms of COVID-19, we would encourage those people to talk to their doctors before getting the COVID-19 vaccine. So again, that is a change. We have been encouraging people to wait at least 90 days. That was in part because we know there is some immunity that is conveyed from having the virus and not having enough vaccine, but we are no longer discouraging people from that wait. I also want to update you on our equity plans and the successes that we've been able to see. You'll remember a little over a month ago, I think it was around March 4th, that we talked about our vaccine equity efforts, that we were going to be working very closely with local communities to help our multicultural communities to get vaccinated, because disparities and gaps there. I'm pleased to report that since then, since March 4th, we have been successful in closing those gaps. Now, we still have a ways to go, but I want to share just a few numbers that I think may be of interest to you. So since that March 4th announcement, white and Caucasians have increased vaccinations at 262%. So again, across the board, we are just seeing incredible numbers of vaccinations. So whites at 262%. Now, I also want to say that the one area where there was not a gap, in fact, there was a gap in the other direction, was with our Native American population. The federal government, together with state governments, had made an effort from the very beginning to reach out to our tribal leaders to get vaccines out there. So San Juan County led the state in vaccinations, and I think still does. They're in the top 3 because our Native American population got vaccinated first, and so they have had an increase in since March 4th of 223%. So very similar to the white and Caucasian population. But here are the other numbers now that I want to share. The Asian population has seen a 459% increase since we launched our equity efforts. Black and African American population at 345% increase. The Hispanic or Latino population, a 463% increase, and our Native Hawaiian Pacific Islander community at 432% increase. So that gap is closing. I can also share just if I have them here, some of those raw numbers. So 6,900 Asian adults have received at least one shot in that time, now up to 31,500. 18,700 Hispanics or Latinos had received at least one dose. Now we're up to 85,800. Sorry, that first number, again, 6,900 Asians had received at least one dose on March 4th. Now it's 31,500. And then our Black adult population, 2,400 had received at least one dose on March 4th. Now we're up to 8,400. Also, again, our numbers with our elderly population continue to be some of the best in the nation. When you look at our most vulnerable groups, ages 65 and over now, 85% have received at least one vaccine. 70 and older, that number is 87%. So that's going to help us continue to drive down hospitalizations and drive down our death rates here in Utah. The transmission index, just as we keep you updated on that, we have 3 counties that have moved from moderate to low, Kane County, Miller County, and Washington County. That is very good news. All of our counties continue to be in moderate or low, which means that there are very few, if any, restrictions. We continue to get questions about restrictions that are out there. There's still a lot of misinformation out there about restrictions that actually don't exist, but that there are many private entities who continue to place restrictions to keep their people safe, and we fully encourage that. Of course, we've seen that with masks now. We have gotten questions around mass gatherings. There are no limitations anywhere in the state on the number of people that can gather together, as long as they wear masks if there are over 50. That is the only restriction that is in place in those still in those orders. We've also had questions about religious organizations, churches or temples. There have not been any restrictions on gathering in churches or temples since, I think, October at all. So religious organizations have continued to put those restrictions in place voluntarily to protect their congregations and others, but there are no restrictions on religious organizations in the state when it comes to gathering, including the mask restrictions. Those do not apply. The 50 and over do not apply to religious organizations. Although again, most of them have voluntarily continued to encourage their congregants to wear masks to keep people safe. That's where we are with regards to our with regards to the vaccine rollout and eligibility and some of the great things that are happening. I will just say it's been incredible to see our partners come together. It's been wonderful to see people getting out and getting their vaccines. I will tell you immediately after this, I'm headed down to get my second dose. It has been 21 days since my wife and I received our first dose of Pfizer, and we're headed back to get our second dose. We're excited about that. Excited to join the ranks of the fully vaccinated. I will say that when I was sworn into office, there were only 305 Utahns who were fully vaccinated, and now just 101 days later, we are at 741,819 Utahns that are fully vaccinated. I will just note that we have now administered over 1.8 million doses total, first and second doses. This is a daily increase of 40,000 doses, over 40,000 doses since just yesterday. A week ago today, our total doses administered was 1.6 million, first and second doses. So this is an increase of 204,969. We're going to round that up to 205,000 doses in 1 week, which is once again a record. That is our biggest week yet here in the state of Utah. So thanks to all of you who have gotten your vaccines. For those of you that have not, there are appointments available. Please, you can go to coronavirus.utah.gov/vaccines and look for appointments there, or vaccinefinder.org is a great place to go and find an appointment, whether it's at one of our public health facilities or with the local pharmacies in your neighborhood. And with that, I'm happy to answer some questions.
Governor, legislative leaders tell me we may be 3 to 4 weeks away from terminating public health orders under the COVID-19 endgame law. We've met the thresholds for case rates per 100,000, hospitalizations with ICU specific to COVID patients. Vaccines are catching up. What do you think about that? Is it too soon? Is it not too soon? How do you feel?
Well, I don't think it's too soon. I think it's great news. I think that's exciting. And the reason that metric, which I think was a much better metric than the mask metric, I wish that we had followed those two together. But again, we've talked about that a lot. What I like about this one is that the vaccine number was included, and that's the important one. More than anything else, we've said that from day one. Nothing matters more than getting vaccines into arms. And so the metric that was chosen by the legislature there is a good and laudable one. So getting those doses, getting them out there, getting people vaccinated, getting people fully vaccinated is our number one goal. The more people we do, the fewer restrictions we will need at all to keep people safe. So we feel really good at that. We had anticipated early on that by June 1st we could get there if the vaccine numbers kept up. Of course, we've had a little blip with the Johnson & Johnson vaccine that I'm happy to discuss if you have any questions there. But our ability, and I think as of yesterday, we were as high as 4th. I think yesterday we were 8th in the nation for percentage of vaccines available to the states that had actually been administered into arms. And so we feel really good about that. If we can hit kind of a mid-May timeframe and get that many vaccines into arms, then we're in good shape.
Do you think we're going to be able to reach herd immunity? Right now, we're at 30% fully vaccinated, but you got to hit 70 before everything's truly supposedly okay.
Well, supposedly, right? There is no definitive answer yet on what herd immunity, what it will take to get herd immunity. We've heard 60%, we've heard 70%, we've heard 80%. The medical community has not come to a consensus on what it will take to get herd immunity. The best numbers we're seeing right now are coming out of Israel. Israel has been ahead of any nation, although the United States is top 5, but they've been the closest to getting the most vaccines out. And it does look like they're getting close to some sort of herd immunity out there. Their numbers continue to drop, and I think most, if not all, of the restrictions have gone away in Israel. So we're watching them very closely. I do think it is close to get herd immunity. I will remind people that there are other ways to get to herd immunity, and it's not just vaccines, but there have been a lot of people that have been infected with this disease who do have some immunity. We don't know how long that will last, but we do know that it is a combination of those things. We certainly think that that's why one of the reasons that the numbers continue to drop here in the state of Utah. It's a combination of people who have already had the disease plus people who have been vaccinated, and then again. It's not just about herd immunity. It's also about driving down hospitalizations and deaths. And because we focused on the most vulnerable, and other states have not, we believe that that's been a major part of our success here. Even though we still have cases, they flattened out a little bit. We've seen some reductions the last couple days versus last week. Yesterday was a very good day for us. Today was another good day of decreases. I think we're down about 30 or 40 cases versus last week. And so but our hospitalizations are coming down, and most importantly, our deaths are coming down. That's the big one, right? And so we're really anxious to get our most vulnerable vaccinated and get them fully vaccinated, and then we don't have to worry quite as much.
Governor, is the Johnson & Johnson vaccine an inferior vaccine? And what do you think? How should the state proceed in terms of administering it going forward?
Well, it's a great question about the Johnson & Johnson vaccine. It's definitely not an inferior vaccine. We're so fortunate to have it. In fact, in some ways, it could be argued it's a superior vaccine because of the one dose that is needed as the 2 doses. it has become the vaccine of choice for many people. Younger people tend to like Johnson & Johnson, again, because it's one shot. Some are harder to reach community. Pause. We, as human beings, we are really bad at evaluating risk. And the numbers with this clotting issue that they're concerned about, the numbers are minuscule compared to. Point this out that I had probably a better chance of having a car accident on my way to this interview than I would by getting the Johnson & Johnson vaccine and having a blood clot. And when you compare it to the odds of somebody contracting the virus, getting hospitalized or dying from the virus, it's not even in the same zip code. And so there are times, I will admit, that I wished that during this pandemic that the medical experts would also include the human experts, people who are part of, who understand human behavior and understand these risks, and that there was a more collaborative approach to these things. And the reason I say that is I am fearful that this will have seriously negative connotations with people who are hesitant to get the vaccine in the first place, who are looking for a reason not to want to get the vaccine, and that more people will die because of this decision to push pause on the vaccine than would have been impacted by the repercussions of this blood clotting issue. So all of that being said, though, I'm not a medical expert, and so we will continue to follow the guidelines as put out by the CDC. There is disagreement amongst many in the community over how and how long and whether this pause should have started or happened, but it did happen. And so what we're going to do is do our very best to use the other vaccines that we have available right now, get them out to everyone, to give people the best information possible so that they can make that decision. And we sincerely hope that we can get through this pause very quickly and move on. One of the big reasons for the pause, in fact, the major reason for the pause, was so that medical doctors could be instructed on how to respond to this condition in the very, 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 very rare case that it actually occurs, how to treat it, because it is different from the way that you would treat other blood clots. And they wanted to make sure to get that information out. That is happening right now. So we're hopeful that we can respond. If there is an issue with a subset of the population, we know that, again, all 6 of these cases were women between a certain age, between the age of 18 and 45. If it's the case that we want to, pause with that subgroup for a while and use this on for other populations to move forward, that would be great. But what we need to do is we need to help Utahns and Americans understand that the risk is so much greater than the risk from these vaccines. We've had no deaths in the state of Utah. And we've had well over 2,000 deaths from the virus right now. So I just hope that this does not cause people to not get vaccinated.
May I?
Will the Johnson & Johnson pause disrupt the state's projections for getting to 1.63 million?
It shouldn't disrupt us much. The Johnson & Johnson vaccine, because it's the newer vaccine, has been a fairly small percentage of our vaccinations. Over the past couple of weeks, we're looking at less than 5%. So it should not slow things down much at all. However, it is an important piece. Where it could slow things down is in helping to close some of those gaps that we talked about in harder to reach communities. And I include in there rural Utah. Where we've been really successful is taking these clinics out to what I call not just our rural communities, communities, but our frontier communities, so our hardest to reach communities, go out there and do a one-day clinic for everyone in the community, where you don't have to schedule it. We're there from early in the morning until late at night. Anyone can come at any time and get that vaccine, and it's a one-shot vaccine, and then we can be done in those communities. So that's where I think I'm most concerned, and most governors are concerned that it will hurt us in those areas. But the good news is that we have so much Pfizer and Moderna coming into the state. Those have been very steady, continuing. In fact, I think there was an announcement yesterday that Pfizer will actually be able to increase their production. And so we still feel really good about the numbers coming into the state.
So just to play back,
Please.
you disagree with this pause?
Yeah, I do. I look, again, I'm not a medical expert, but I think there is so much that we have to weigh in the balance here. Again, I understand why they did it. By the way, we saw the same thing with AstraZeneca in Europe. And if you look at the European numbers, now they've taken the pause off of AstraZeneca. But what happened is there was one country that didn't pause, and that was the UK. And my understanding is that vaccine hesitancy in the UK didn't change at all with this issue. However, in most other European Union countries, after the pause, they saw an increase in vaccine hesitancy because of that. And so while I understand and look, it's important to get these right. Safety is critical, because if the vaccine's not safe, people aren't going to get it. But is there a better way to do this? Is there a way to say, hey, again, fully transparent to the public by saying, hey, look, this is an issue. It's something we're concerned about. If we know this is happening, again, women in a certain age. So let's maybe pause there and have them get the other the other vaccines and continue to use Johnson & Johnson for other things. So that's what we're evaluating here in the state. It's unlikely we'll do anything different than the rest of the country. Again, this is a national effort, this vaccine effort, and the truth is we do still have some of this Johnson & Johnson here, but additional doses aren't coming into the state until the vaccine pause is over.
So do you have the opportunity, do you have the ability to go it alone if you decided to?
Only with the vaccine that we still have here in the state.
So going forward, any new vaccine coming in, you would have to abide by CDC guidelines?
They're not sending any more Johnson & Johnson to the states until this issue is resolved. Now, we had a conversation with the White House. We've talked about this. They're very hopeful. In fact, Dr. Fauci said that this will be minimal. We're going to push really hard to get this resolved, get all of the information that we can on this so that we can resume with the Johnson & Johnson vaccine as quickly as possible. We anticipate from what that it will be a week or a little more than that, but we're not talking months. So again, I do think it's important, and we appreciate our media partners to be able to put into context what we're talking about. That I think is the most important thing. I think if we give people good information, they'll make the right decision. When you realize that you're far more likely to get eaten by a shark or struck by lightning than you are to develop this very rare blood clot issue, then people will realize that getting these vaccines is good. And to point out right now that, again, we have two vaccines that we know do not have any of these issues. And so please go and get this vaccine. Don't make that decision based on a concern that is being addressed.
Okay, we'd like to go to a remote reporter right now. Bethany Rogers with Salt Lake Tribune. Go ahead with your question.
Hi, Governor. I was just wondering if, in light of the parent protests demanding that the mask mandates be lifted immediately in schools, if you're considering changing that date, or if you expect to stick with that until the July 1st deadline.
Yeah, so we're going to continue with where we are right now. Again, we're constantly evaluating and reevaluating things, and I've spoken to this issue many times. But to those parents and those students, I understand this is so hard. I would like nothing more than to be completely done with masks everywhere. That's our goal. That's what we're driving towards. We're so close right now, though. And so my encouragement would be to stick with us. Let's finish this out. We're not going to come back with masks in the fall. We're going to be done with this. We're excited to be done with this, and we're getting there. We're very close. But just hold on. If we were to take masks away right now, there are a whole bunch of kids who would not be able to come to school, and we want kids in school. I was talking to a school administrator yesterday, and he said, it's really interesting. For the first time in a long time, we have teachers from other states who are flooding into Utah because we've been able to keep schools open. We've been able to keep students and teachers safe. We've prioritized teachers in vaccinations, and we've been able to keep kids playing sports. That was all because of our testing protocols and on our mask wearing in schools, which kids have been so good at. Our kids are showing us, by the way, they're a lot better than parents. They're showing us that they can do hard things, that they're willing to do hard things to get us through this. It's been inspiring to see. And so we're going to stay the course. We're almost there. And we encourage people to just hold on for a few more weeks.
Okay, Emily Means with KUER, go ahead with your question.
Hi, Governor Cox. This past week, we saw threats against business owners and their employees for trying to enforce their mask policies. And you've asked people to be kind and to be respectful, but there's still a risk. So what can the state do to support these businesses now that the statewide mask mandate is over?
Well, we're working very closely with those businesses. I will say that there are a lot more to both of those stories than were originally shared. These were individuals who have had problems in the past, and the problems weren't as tied to mask wearing as were originally reported. So we will continue to support. But this is what I've said. That type of behavior is unacceptable. By the way, you don't get to threaten people. Businesses have the right to make these decisions, and we will hold you accountable. We will prosecute you to the fullest extent of the law if you threaten people. It's unacceptable, and we won't allow that here in the state of Utah.
All right. Thank you so much, Governor. That's all the time we have for our television broadcast. And join us back here again next month for the Governor's Monthly News Conference. Okay, and we would like to continue with our Skype reporters. Lisa Riley Roach with Deseret News. Go ahead with your question.
I think you're muted, Lisa.
Okay.
We can see you, but we can't hear you.
Let's go to Chris Reed with St. George News. We'll come back to you.
Okay.
Good morning, Governor, and I hope you can hear me.
I can hear you, Chris.
Okay, great. Good to hear from you. And, this is the time of year here in southern Utah where we see the spring breakers come down from up north, as well as those from out of state. And I have to mention that, I've been out and about myself around town. And one of the things I hear a lot from people out of town is, my goodness, it's like COVID doesn't exist here. Is that something people should take pride in here, or should that be a sign that maybe people need to take a little more preventive measures until we're through this?
Well, thank you, Chris. I think it's probably a combination of both. It is something. So what we do know, and there was a new study that came out again yesterday, which confirms something we've known for a long time, and that is that being outside is a great thing. That there are very, very few documented cases of transmission that have come from being outside. And so the truth is that in places like Washington County, the coronavirus doesn't exist as much. In fact, I just mentioned that Washington County was one of those counties that has moved into the low transmission index. And we really believe that is driven in large part because people are outside so much more. It's beautiful weather down there. It's perfect spring temperatures, 70, 80 degrees almost every day. There's a reason that people come down there for spring break, right? And so by being down there and being outside, you are much less likely to transmit this disease compared to places where it's cold and we have to be inside together for much longer time periods. And so that's all very, very good news. Now, again, also, vaccinations are happening, and vaccinations are happening at a higher rate amongst our senior population, our most vulnerable population. And Washington County has a disproportionate number of people who are in that age category. We have a lot of snowbirds who spend their winters down there, and many of them have already been fully vaccinated. So it's a sign, it's a good sign. It's a sign that normalcy is starting to come back. Now, what we would encourage is we would still encourage people to understand that it is not gone. We are still hospitalizing 20 to 30 people in the state every day, and that's very serious. And so if you are not fully vaccinated, please be careful. If you're spending time inside in large groups, we still encourage people to wear masks and protect those around them from getting the virus. But I think it's mostly a good sign. As we start to see 70 and 80 degree temperatures here along the Wasatch Front, we'll see more and more people outside, and I suspect we'll see numbers continue to come down like you're seeing there.
Follow up. There's kind of part of the return to normal, so to speak. The Iron County Commission, right around Cedar City, has formed a committee to review governor's orders. And we all know about governor's orders from the last year or so. And they say it's based on HB 415, where the state basically gave the power to review executive orders from the president. So do you think local counties and cities can, so to speak, defy your orders if they deem them unconstitutional?
That's not how it works. We are a rule of law country, and there is a way we do things. Look, governors do this kind of stuff all the time. They pronounce proclamations that are basically meaningless, because the way it works is whenever someone does something that we think is unconstitutional, then what we do is we have a system for resolving that, and that system is the court system. And so when President Biden does things that we think are unconstitutional, and he has and he will, then we will go through that process, and we will challenge those pronouncements and those orders, and ultimately the courts will decide. Sometimes up to the Supreme Court. That's how we do all of this stuff. That's how this works. Individual people don't get to decide what is and is not constitutional. And so the same thing happens at the local level. If they disagree with something I do, and I'm certainly not perfect, then we have a method for resolving those things. And those counties can challenge those things. But look, we resolved most of those concerns. In fact, several of the bills we worked very closely with the legislature on to better define the types of things that the executive branch can do. Because make no mistake, again, I've said this many times, anytime we use some sort of executive order, especially in an emergency, what we're doing, unless we're just telling state employees what we're asking them how to follow the law, then we're using legislative power that has been delegated to me. And the legislature does that. They have given me power because it's impossible for them to respond quickly. And so that's what we do. And we better define that. And so I think we're in a really good place moving forward. Now, the counties have the opportunity to do that same thing in their own counties with their own officials. And but you have to remember that the counties and cities, their legal authority actually comes from the state. It's not the other way around. The federal government, this is so important historically, and I don't want to get too wonky, but I really care about this stuff. The federal government derives their powers from the states. And the federal government forgets that often. But if you look at the Constitution, the powers of the federal government are very defined, and everything else belongs to the state. It doesn't belong to counties and cities. It belongs to the state. And so the state in the United States is the core of all government power. And so that means that we have to work really closely with our state, with our county and local elected officials. And I say this all the time. We should defer to them because they know what's best for their counties. I try to do that as much as possible, but ultimately the state is responsible for what happens in those places, and the legislature has defined that very clearly.
Okay.
I wanted to ask you about Vicky Chavez, who sought sanctuary in the Unitarian Church 3 years ago from being deported, is now being granted a stay of removal. Your thoughts on that? This has been going on for 3 years.
Yeah, I think it's great. I really do. I think it's a great opportunity. We are a state that cares deeply about people who have been subject to just horrific acts in their country. We are a state that was founded by political refugees, including my own family, and we are a state who has always welcomed refugees to come here. So I think it's great that she'll have an opportunity to stay here, and we look forward to helping those who are in need when they are assigned to our state.
Okay, we have a question from Roger with KCPW. Go ahead.
Oh, we can't hear you either,
All
Roger.
right.
Let's see. Hopefully we can get you connected, both of you. Sometimes in Zoom, if you go up to preferences and audio, you can find a different connection there. I've had this problem multiple times over the past 6 months.
Okay, Jacob with KSL.com, go ahead with your question. Hopefully we can hear you.
Good morning, Governor. How's my audio?
You're good, Jacob.
Good. I just had a quick question for you going back to the Johnson & Johnson blood clotting issue. Earlier in the week, I heard that there have been no cases reported of that happening here in Utah. Is that still the case to your knowledge?
Yeah, as of last night, I haven't, and I think I would have heard if there was anything this morning. As of last night, we have had no reports of this clotting issue at all. I would also like to point out for people who are maybe wondering, who have maybe had a reaction to their shot and wondering if this is the same thing. I mean, this is a very specific issue, and it doesn't manifest itself until at least 6 days. So 6 to 13 days. I think day 9 has kind of been the average day. And so if you're feeling something the first few days after your vaccine, it's certainly not that. But yes, we have not had any instances or reports of this issue here in the state of Utah.
Okay, do we have any other questions in the studio?
Has anything come of your discussions with the Biden administration about the future of Bears Ears and Grand Staircase Escalante National Monument?
No, Ben, we have not had any feedback yet from the secretary in her return. We talked a lot about this. It was a wonderful visit. We're very hopeful that the administration will work closely with us and find a legislative solution to put this to bed once and for all. But we don't know kind of timeframes on a decision yet. But the Secretary Holland was very gracious in her time here, and has said she's willing to work closely with us, and will let us know as more developments are available.
You signed HB 294, of course, and there's nothing in that bill, now law, that speaks to whether a city mayor can impose a mask mandate.
There is not. It talks about counties,
yes,
but it is silent on cities.
So do you think that Mayor Mendenhall in Salt Lake City had the authority to impose a mask mandate? It's
a good question. And there are probably legal arguments on both sides. I don't know that I could weigh in on the legality of that. But what I will say is that the legislature, including those who were drafting the bill, have said that they're not going to challenge that. And so I think the answer is probably yes. But that would take an attorney to do the legal review and maybe a judge to decide whether it's legal or not. She has done that. There hasn't been a challenge to it, and so I think it would stand.
When do you think that should lapse?
Well, I think that personally, as more and more people get vaccinated, and we're getting close, I think once we reach those kind of numbers that we've been talking about, that we have put out there, once there's enough vaccine here for people that want to get a vaccine, and we start to see those numbers increase, then I think most of those will go away, and I suspect that there will be pressure on those elected officials for those to go away. So I would suspect that mid-May, June timeframe, we would see those go away. But again, that's not my decision.
Okay, and I'm hearing we have Roger back. So Roger, go ahead with your question.
And we're still not hearing you, Roger. I'm so sorry. Tweet at me and we'll try to get your question answered.
Okay, we'll try Lisa. Let's see if Lisa's
Lisa,
available.
are you with us now?
Let's see. What do you think, Governor? Can you hear me?
I can hear you now, Lisa. We did it.
Great. Governor, I just wanted to follow up on the Johnson & Johnson vaccination issue. There's a lot of concern around the country that, and you spoke a little bit to this, that this is going to affect the uptake of vaccines, that this will be used as an excuse not to get any vaccine. What does the state need to do to reach out to citizens and encourage them to overlook this pause and still get vaccinated, whether it's with Johnson & Johnson once the pause is lifted or partially lifted, or go ahead and get the other? So what is the state doing specifically to reach out to Utahns?
Yeah, thanks, Lisa. It's a great question. And I have to say, I've used the word muted more times in the last year than I think the rest of my life combined. So I'm glad we were able to get you unmuted. But this is going to be critical. We have been working very closely with public partners and private partners on education campaigns to encourage people to get vaccinated. I think it's important to know that there's a group of people that will never get vaccinated no matter what. And there's a whole bunch of people, more in Utah than any other state, that are going to get vaccinated no matter what, because they understand what's at risk. They understand how important this is to get back to normal. But there's this group in the middle who are willing to get vaccinated, but they're a little hesitant and not sure. They're kind of waiting to see what happens. And that's the group I'm most worried about, because that's the group we really need to get vaccinated to help us get back to normal, to help us get closer to herd immunity. And so we're going to have to continue to educate. And again, we're going to need your help. And I think we do that by being really honest with people. I think we do it by showing them the data, by helping them understand what the data means, because it can be very confusing. And so we want to point out what this means, what it doesn't mean, maybe more importantly, and who is at risk and what the risks are if you don't get vaccinated. And so I think that's what we're going to have to do. That's what we will continue to do. And look, again, I back to this Johnson & Johnson thing. I don't want to overplay. The one thing I've learned through this pandemic is that we need to be humble about this stuff. There are so many hot takes in the moment, and everybody has been wrong at some point during this pandemic. Every single person has been wrong on something. And so I'm probably wrong on this one. It's very possible that I'm wrong on this one. And that the pause will look back and say the pause was a very positive thing overall. The truth is nobody really knows until we see it play out. And so I'm hopeful that this is as rare, a 1 in more than 1 million chance of actually getting it, a 1 in 6 million chance of actually dying from it so far. Again, those are very small numbers, small sample size. It may be bigger than we think. We may discover more cases. And I understand that they're trying to be safe. They're taking this pause to increase people's belief or people's faith in the system so that they can say, hey, look, this works. We are being so careful and so safe. I tend to think that it will have the opposite effect, and I think we've seen that in Europe, and that's why I pointed that out. But I could totally be wrong on this. But what I do want to do is I want to be transparent. I want to give Utahns the best information possible and help them make that decision. And by the way, making vaccines easier for them to get is going to help. That's why we're expanding. We're getting into neighborhoods. We're making it soon so you won't have to get an appointment to get this done. So you can go just about anywhere and get it. You can get it anytime. As we increase supply and as demand starts to slow down, we can do some of these other things that will help close that gap.
Okay, and I have Roger's question.
All right, we got Roger's question.
You described earlier in this press conference challenging executive pronouncements and the idea of deferring to counties. Today, the San Juan County Commission is in favor of restoring, if not increasing, the size of Bears Ears National Monument. How does that weigh into your thinking on monuments? Yeah, so look, again, this is a very controversial one. And the last commission was in favor of shrinking the monument. And this commission is in favor of growing the monument. These monuments issues
issues are so much bigger than any one county or any three people. It's a huge and divisive issue, and that's why I think it's so important. Again, this is a national issue. This is a federal issue. That's why it's so important to have Congress make this declaration and this decision, as opposed to the president. The Antiquities Act is the most un-American of laws. It's the most un-American. This idea that one person, a single person, can, with the stroke of a pen, lock up millions and millions of acres without any deliberation, without any negotiation, without any debate, without having to get buy-in from different groups. And it's easy, right? I mean, it's much harder to go that route. But it leads to these terrible, terrible consequences, in which, by the way, I had a tribal leader say, one of the most disappointing things is now we have all of these people coming here. Well, the reason they have all of these people coming here and destroying the antiquities is because it was made a national monument, and now it's on a map and everybody wants to come here, except that the one thing the president can't do is to get resources to that area for law enforcement, for bathrooms, for parking lots, for trails, things to actually protect the antiquity. So now we have 5 times more people coming there than just 5 years ago, and we don't have any way to deal with those people. And they're loving these antiquities to death. We can do that through a legislative process, and I think that's so important. And the last thing I'll say on this issue is this: I do believe that the way presidents have been doing this in the past is a violation of the Antiquities Act. This is something that doesn't get talked about enough, but the Antiquities Act itself says that that a president can only do this, that the size of the monument has to be the smallest size necessary to actually protect the antiquities in question. And the Chief Justice of the Supreme Court, in a recent decision, as kind of an aside, just said, hey, I'm kind of worried about presidents doing this, and invited a case to challenge these 1 million+ acre monuments that are, again, with just a stroke of a pen, happening out there. And so we think there's a better way. We think there's a way that everyone can win, that everyone can come together, and that everyone can find a way to protect these sacred lands in both the Bears Ears and Grand Staircase National Park. So that's what we're pushing for. That's what we're working towards. And we've got good faith assurances from Congress that they will work on this. But ultimately, we'll see what the president decides.
Anything else in studio?
Governor, you just recently appointed your homeless officer, former Senate President Wayne Niederhauser. How quickly do you want him to move to find solutions for this summer, knowing it's coming up fast and, of course, this winter, so leaders aren't scrambling again to set up overflow?
Yeah, well, we're so excited to have former Senate President Wayne Niederhauser on board. This is such a tricky area, and there's so many different groups to navigate, the most important of which are those that are experiencing homelessness. And so the good news is that former President Niederhauser has said he is willing to jump in quickly. It is important that he engage very quickly with everyone, all of those groups, with the service providers, of course, the individuals experiencing homelessness, the legislature, the funders, the philanthropic community. All of those people have to be engaged very quickly, because this is a problem that isn't going away. We are now heading into the warmer months of the year, and but we know time moves quickly, and winter is just around the corner. And so he will be the central focus of bringing these groups together to work on solving these problems. And so the answer is, he knows this. He feels a sense of urgency. We feel a sense of urgency to get him moving. The law hasn't technically gone into effect yet, and we don't have funding for the office technically until the new budget starts, which is around July 1st. But we can't wait that long, and so he's agreed to start right away on a part-time basis at least. And we're scraping to find some funding within our administration right now, so that we can get this position going, and we don't have to wait until July 1st.
Okay, Emily with KUER has another question for you. Go ahead.
Hi, Governor Cox. I know you said the last thing you were going to say about Bears Ears, but I have another question.
Okay.
What is the backup plan if collaboration between the state and the federal government fails and President Biden expands Bears Ears by executive order?
Well, I don't know if there is a plan B, because again, our hands are tied at some level. So, but I do think there are two options. One is Congress can always override any type of presidential decision on that issue, and so I think we will continue to try to work with a congressional solution. Although I will say, I think it becomes much more difficult if the president does that unilaterally. Then I think the appetite for some sort of congressional resolution goes down dramatically, and so that would be an option, but it's probably not a great option. I think at that point the best option is really to take the advice and the recommendation from the Chief Justice of the United States Supreme Court, and to give them an option to weigh in and help us decide once and for all: are we going to have the ability for presidents to lock up millions of acres, or are we going to force them to actually follow the Antiquities Act and make those areas as small as possible to protect the actual antiquities?
Are you saying that you would sue?
Yes.
Tell us more about that. Do you want to resort to that?
No, heavens no. And I've said that well, not a million times, but I'm working on it. No, that's the last thing I want. I think we're all so tired of this. We're tired of lawsuits. We're tired of fighting. We're tired of the back and forth. We're tired of all of this. And that's why we're offering this real opportunity in this olive branch. And I hope you've seen, I don't know, this was very intentional to that this time around. It's very different. It's much less hostile. It's not, we're not trying to it would be really easy to make this a wedge issue. It would be really easy for me and my base to just throw bombs at the administration and to just, pound the podium and say, we'll see you in court, if you try to do this. That's not helpful. It's not, it's not what we want to do. What we want to do is we really want to solve this, genuinely solve this. I mean, I wish you could have been there with us with Congressman Curtis. And that guy, by the way, is incredible. And he has done the work. He walks into that room and Secretary Holland, who served in Congress with him just for a couple of years, but you would have thought they were friends from the time that they were kids, because he's that well respected. And I've met with the tribe since becoming governor. I've had Zoom calls with the 5 members of the tribal council. We're working very hard to understand what it is they want. And it's really interesting, by the way, to try to understand what they want. Yes, they want a bigger monument, but when you try to get to the heart of it, they also don't want people to come and to overrun these areas, which leaves them in this difficult situation. They also want their tribal councils to be more involved with the management of the land. You know what? Those two things can't be done via executive order. Those can only be done through legislation. And so there's an opportunity to give them what they want, and then to help people on the other side to be able to feel like they're not being left out, that they're not being economically disadvantaged for generations to come, in a way that benefits everyone. And so that's what I want to see. And I'm very hopeful. But what I'm saying is, and what I was asked is, if that doesn't happen, what do we have left? And I fear that's what we do have left. And so we don't want to go there. I'm not encouraging that. I'm not posturing as a way to say to the administration, hey, if you don't do this, we're going to sue you. I'm just talking realistic, because we've done this before. By the way, this is what happened. So President Obama declared a monument, and we all sued. And then President Trump undid the monument, and they all sued. So we just flipped places, and now that lawsuit's on hold, waiting to see what President Biden does. So we've got this perpetual lawsuit, and it's so dumb, and it doesn't help anybody and doesn't make anything better. So no, I don't want that to happen. But if I'm being practical and realistic, and I probably shouldn't be, but that's what's likely to happen.
Okay, thank you so much for answering all of our questions. We are out of time, and we will see you back here next month.
All right, Skype too. Test.